If you suffer from mild to moderate constipation and want to know a natural treatment, watch this video. This video applies to patients with Parkinson's disease and without Parkinson's disease. Let's start with the first step, which is adequate fluid intake. I'm talking about water, no beers, no soda, just water. The question is how much water? Well, this is difficult to be sure, but I typically recommend at least 2 liters of water per day, but everything depends on many factors. For example, the amount of exercises. Where are you living? If you are living in a place with high temperature, high humidity, that means that you need more water. If you have chronic kidney disease, you need to talk with your kidney doctor to ask how much water you need because things are a little bit more complex. If you are one of those patients that don't like to drink too much water, try to eat watermelon. The other thing is your body will tell you. If your system is working well, your body will tell you because you will feel thirsty, and you feel thirsty, your body is telling you, give me water, let me drink water. Also, the urine, the color of your urine will be yellow. So if it's too yellow, that means that it's too concentrated. So you might be dehydrated, you need more water. Also, the smell of the urine. So stinky urine, that means that it's too concentrated, you need more water. The second step is adequate fiber intake. There's nothing better than getting the fiber from food. No pills, food. Remember, there is few things that you have control in life is the amount of exercises that you do and what you eat. So try to eat all of these vegetable fruits and nuts that you see in the screen. Pay attention to the ones highlighted. The recommended amount of fiber per day is approximately 20 to 35 grams. Now, I have to tell you that if you are new with this and you typically don't eat too much fiber, and you start with food with high amount of fiber, you might have side effects. What are those side effects? So approximately 50% of the patient, they might feel bloating, abdominal distension, and gases, a lot of gases. So I would recommend you to start low, which means try to eat more of the food with less amount of fiber and progressively increase because you might have what we call slow transit constipation, which make things a little bit more difficult. Now let's talk about my secret. And actually, it's not a secret because many people are doing this. When you wake up early in the morning, in my case, I wake up at 5:30 a.m. You prepare your coffee, okay? Not the night before, not the day before, just at that time, at 5:30 a.m. in my case, when you wake up. If you don't have time to do that, just wake up earlier. What do you need? And I will tell you exactly what you need for this. Number one, easy. You need a coffee maker machine. Small, you don't need to have a big one, just 5 cups. And small filters, compatible with your machine, obviously. Then, what type of coffee, which bean? So, which means don't think that there is only one type. There are many, but the most common and the one that I want you to try is the Arabica coffee. Arabica coffee. That's the one that you should try. Then the other point is the concentration. So for every 1.5 cups of water that you see here in the picture, it say 2. The line is marking the number 2. This is actually equivalent to 1.5 cups of water. You add 2 teaspoons of coffee, okay? And I will, all these ingredients will be in the description of this video below and in the screen as well, okay? Then you prepare your coffee, and then the next step is sugar, right? If you don't like sugar, then don't put sugar, but I cannot drink the coffee without sugar, so I had to put some sugar. So I will use, in my case, 1.5 teaspoons, which is approximately 24 calories, if you want to know. Now, if you want to drink black coffee, good for you. In my case, I don't like the black coffee, so I need to put a little bit of milk. What type of milk I use? Organic milk, 1%. Then the amount, everything depends. How much darker or whiter you want the coffee. Now, remember that if you are taking your levodopa with milk, the absorption might be affected. So you might probably need to separate the milk with your levodopa. That I have multiple videos about that. And not every patient is sensitive to this questionable interaction. Okay, so that's a different topic. Now, important is to make sure that the coffee is hot. So what I do is just to put the coffee in the microwave, 45 seconds. That's enough for me, but everybody is different. But it need to be hot, otherwise it's not gonna work. Number 3 or number 4, then you sit down, enjoy your coffee, start reading, check your emails, just sit down and relax and wait approximately 30 minutes and you will see. Okay, in approximately 30 minutes, or some people even before, you will feel the sensation that you need to go to the bathroom. You need to have a bowel movement. Don't wait, just go. That's the key. You need to do this every day because remember, in Parkinson, and even without Parkinson, things work better if you have a routine. Sounds boring, but this is what it is. You need to do things at the same time. Otherwise, things are not going to work well. By the way, there are some studies indicating that if you drink coffee, the probability of having Parkinson's disease is less. There are no randomized controlled trial about this, which is the best type of a study, but there is a clear indication, association that if you drink coffee, you are less likely to develop Parkinson's disease in the future. This is another reason to drink coffee. If you like this video, don't forget to subscribe to my channel. See you soon.